from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back to Daybreak. Today is Wellness Wednesday. How often do we hear of someone having thyroid problems? And what does it really mean to have thyroid issues? Joining us this morning to break it all down is Baptist Health's Dr. David Gerson with Sherwood Family Medical Center. Dr. Gerson, good morning.
Good morning.
Many people wanting to know, first off, what is the thyroid?
Well, it's your master gland. I mean, it's kind of the thermostat of your body. It's located here in the front of your neck, and it does everything from maintaining your body temperature to controlling your weight to keeping you awake. So it's pretty important. And what's interesting about thyroid disease is very often you don't really think about it, and it's found when we're screening you during your annual exam.
Got you. So are there any symptoms that someone would have to know if they're having thyroid issues?
Well, that's the challenge, right? Because you could be hyperthyroid, you could be hypothyroid. So you could have unexplained weight gain, you could have unexplained weight loss. You could be hot, you could be cold, you could be irritable, you could be depressed. That's the big problem with it. I guess the number one thing we see in our clinic is when patients come in, sometimes they'll have some movement issues. They'll have a little bit of a tremor. They'll have a difference in their appearance. Their family members will say, hey, your eyes look like they're more prominent. And so that's kind of a telltale sign that you're having a thyroid problem.
And I know you said you notice it during exams. How do you all treat this?
Well, again, it depends whether you're hyper or hypo. If you're hyper, there's medications and there's surgery. Hypo, that's just medication. And so we're fortunate in that this is a disease we've had for a long time, and so we've got good medications to treat for it if it's low. Being high can be a challenge, but it can be well controlled.
Got you. So anyone dealing with this morning, at what point should they see a doctor?
Well, just like I said, if there's something that just doesn't make sense, or if you have a family member or a friend saying something doesn't make sense, again, your appearance, your weight, you have a tremor, irritability and agitation, not sleeping well, even hair loss, right? Any of these things can be a sign of your thyroid being not functioning correctly. And then again, also, come see us every year for your annual, because very often we'll find something on screening.
Great advice there. Do you see this impacting more men than women, or African Americans more than Caucasians? What are you seeing at your practice?
Typically, it's mostly female, but I think as far as ethnicity, it's an equal opportunity problem.
All right. Thank you so much for joining us this morning, Dr. Gerson. And you can contact Baptist Health by going to baptist-health.com or calling the Baptist Health Helpline at 1-888-BAPTIST.